This is the Emergency Medical Minute.
Okay, so we've got a medical minute on an exciting new medication that may one day be in an ER near you. So if a patient comes in and they've got like a heart rate of like 160 and it's just consistently 160, what are you thinking in terms of your differential?
Cocaine.
Let's say they're 25.
Cocaine.
Cocaine. Claire automatically assumes the worst in people and thinks they're all doing coke. He is coke negative. He is actually a preacher and just got back from meth. Okay.
Just got back
So no, what's on your list of like arrhythmia? Come on, guys. Young, healthy guy. SVT, right? Yep. Because AFib, it kind of bounces around, but like 160 is a pretty classic thing for SVT. So SVT, how do you usually treat it? Huh? Adenosine is great, right? And then also before adenosine, though, we'll often try Valsalva maneuvers. So there's two Valsalvas, the one where you just basically have them bear down, and then there's that modified Valsalva where you basically have them bear down and then you lift their legs and lay them back, right? And the kind of rate of conversion with either one of those is, the original was like 10 to 20%. Actually, it's around 10%, and then the modified is around 40%. So modified really does convert a lot of people if you do it right. And then adenosine. But what's the problem with adenosine? It's uncomfortable, right? People make their adenosine face and they like think they're going to die for like 5 seconds, you know? And it's like, just makes people feel like absolute crap. So there's a new medication that's just coming out whose name is Etripamil. Etripamil, right?
What is that named after?
So it's a verapamil type thing, so it's a calcium channel blocker, but it's intranasal. So there's actually a study that came out earlier this year where they had people who had a history of SVT. They went with a cardiologist to the lab and they induced SVT. And then they squirted stuff in their nose, which was either placebo or one of 4 doses of Etripamil. And here's the thing that is interesting. In the placebo, 35% of people converted, right? So I always say the placebo effect is very, very real, even with SVT. But the Etripamil, they actually converted over 80% of people with a single squirt in the nose. So it could be a really big game changer in how we treat SVT, no IV, just a squirt in the nose. And then also something where if people have recurrent SVT, this is something they might just keep at home and when they go into SVT, treat themselves. So
how does it does it work? It doesn't stop.
It's a calcium channel blocker. So what it does is it slows all adenosine and everything. What they all do is they slow kind of conduction through that AV node, and that's how they break the circuit, you know? So even if you use some things like beta blockers and calcium channel blockers, they'll slow sometimes conduction enough that you'll break an SVT. Adenosine does that most effectively and most acutely. Oh, does that? So, no. The adenosine stops.
So
Yep.
then the E doesn't stop at all.
Exactly.
It slows it to the point of converting, but not stopping.
Yes. Etripamil does not give you the big pause that adenosine does because it's a calcium channel blocker. So cool. So maybe in another few years we'll all be using that drug.
Right.
Okay. Thank you, friends.
Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.